This is something that affects hundreds of thousands, and there's been a lot of media attention about this, MS in particular, in the last week, because you may remember Jack Osborne, he was diagnosed with it. Also, Ann Romney, she's been on the campaign trail with her husband, and she's been talking about her challenges with the disease. And so joining us today is Scot Ackerman, Dr. Scot Ackerman. He's one of the First Coast's leading oncologist doctors. He is here with us every week to discuss a variety of health topics. And today we're focusing on MS. It's a disease that doctors and researchers have not been able to find out a cause or a cure for that matter. So we're seeing this a lot in the news, Dr. Ackerman. But what is MS? What exactly does that mean to have MS?
So MS, Casey, is multiple sclerosis. It's an autoimmune disorder. It's where the body attacks itself a little bit. So in our body we have nerves, and surrounding the nerves is a sheath called myelin. And that myelin sheath is very important in the electrical transmission of signals up and down nerves. Now, we use our nerves to sense things when we can pick up things. We use our nerves to sense hot or cold. Nerves are used for muscle control. And so when the myelin, the sheath around them, is disrupted, and the myelin could be in the brain or the spinal cord or wherever, when this myelin is destroyed or a scar forms on it, that changes the way the electrical signals are transmitted, and they're not transmitted properly.
So what is causing this disease?
We don't know. That's a big question with multiple sclerosis. We don't know what causes it. We think that there might be a genetic component. We have seen some frequency of it in certain families. And we think that maybe if you're predisposed to it and have a vitamin D deficiency, that you may have a higher chance of getting it. So be sure you get enough vitamin D. That'll help minimize your risk of MS, but that's not it alone. It's not genetics, it's not just vitamin D. We don't know. But what we do know is that there's about 2.5 million people worldwide with MS and about 400,000 people in the United States. We also know it's more common in women than in men, and the usual age of onset is somewhere in the 20s or 30s and sometimes in the 40s.
Okay. And then, so what kind of symptoms, if someone has MS, are they experiencing? Well,
the symptoms vary a lot on the severity of the disease. If the disease is very severe, you have much more symptoms, and if it's not, you have only a little bit of symptoms. But typically the symptoms in MS are multiple symptoms, hence multiple sclerosis. So you're going to get multiple symptoms because it's affecting multiple nerves around the body. So if you have a weakness, it could cause weakness in the arms, or weakness in the leg. It can cause numbness, loss of balance if it's involving the brain, or muscle spasms, problems with speech or vision, sometimes even pain, and over time, just an overall neurological decline. So it starts with some very slight symptoms. You may feel that you can't sense things in your hands so well, or some weakness in the leg, but then you get this neurological decline where you're having other neurological weaknesses and symptoms that get worse over time.
So here's a question I'm sure people who have family members would want to know, or anyone who's just curious about the disease in general. Is this something that can be treated?
Yes, it can be treated, but it can't be cured. Okay. There's no cure for MS, but there's no cure for a lot of diseases that we see. Casey, there's no cure for diabetes. There's no cure for hypertension. We control diabetes with insulin and insulin-like drugs, and hypertension, we treat those patients with hypertensive medications, but they're never cured. So with MS, we have medications to minimize the symptoms, to try to modify the symptoms and slow down the neurological decline, but these drugs don't always do that. There's also alternative therapies. We heard last week about Ann Romney was publicly talked about the horseback riding. That's called hippotherapy or dressage. And horseback riding has been shown to be helpful in a number of different neurological disorders, and we don't know why. We just know that it does help with MS and other diseases. In MS, it helps with balance, and helps control the pain, and helps improve their patient's emotion and some stiffness. We've also seen it help in patients with other neurological things like autism or cerebral palsy or some learning disabilities. So there's something to that.
Yeah, and so if someone is experiencing these symptoms, then what kind of tests will someone such as yourself, a doctor, perform to then figure out if they do indeed have MS?
So if someone is having some neurological, some weakness or some loss of sensation, they usually see their physician. And one of the first tests that might be done would be a electromyogram or maybe even an MRI. An MRI of the brain or of the spine is good for MS because we could see some scarring in those nerves. It's very hard to diagnose MS. There's no one great diagnostic test for MS. We also do lumbar taps, lumbar punctures to look at the spinal fluid and see what sort of proteins are in there. There's lots of diseases that manifest themselves with symptoms very similar to MS. So it's important for a patient who has multiple neurological problems to see a neurologist, and preferably one that has an emphasis in his or her practice with MS to make the correct diagnosis and get treated properly.
All right, Dr. Ackerman, thank you so much for bringing some of what's in the news and then clarifying it. Because, you know, when something usually happens and there's something like this where there's a disease or whatnot, and it's nice to just find out what really is the situation behind it. So thank you very much for your insight and perspective. And we also want to thank him for sponsoring this segment. And Dr. Ackerman is going to be with us every Friday. And next week, we're going to be talking about mosquitoes and ticks, the diseases that they carry. So stay tuned for that. And of course, for questions regarding this topic or any other health questions that you might have, you can visit firstcoastoncology.com. You can confidentially submit your questions to ask the doctor anything that might be on your mind.